I'm Dr. Jasmine, working as assistant professor in Travancore Medical College, Kollam, Kerala. So last class was an introduction about anatomy. So did you read about that?
Yes, ma'am.
Yes. Can you tell me who is the father of anatomy?
And
Andreas Vesalius.
Very good. And who coined the word anatomy?
Aristotle.
Aristotle.
Aristotle. So what about the positions? What you meant by the anatomical position?
supine
Reference
person,
position.
Reference position for what is the purpose of that reference position? Anyway, today we are going to deal with some terminologies commonly used in anatomy. Okay, so its meaning and how, where you use these terminology, all these things will be discussed here. So the first thing is about the positions of the body. So first thing is the anatomical position. Obviously, it is a reference position. So what are the criteria to say it is an anatomical position? Hmm? The first, the eyes directed forward. The person should look straight. The upper limb should hang side of the body. The palms of the hand should turn forward. Fingers should point it straight down. The lower limb or your leg, including the feet, will parallel to one another with feet flat on the floor and toes pointing forward. So this is the anatomical position, and this is the anatomical position. So you can see that. One second. So anatomical position we already discussed, and so the position is just like the eye should be straight and your upper limb should hang to the side of your body. Am I audible?
yes,
Yes,
ma'am. Yes, ma'am.
Okay,
Yes, ma'am.
together. Okay. It's already discussed. And another, the body parts and their relationships are always described, presuming that the body is in the anatomical position. So it's mainly help to identify the position or comparing the positions of different organs in your body. So now other positions of the body, it's already discussed in your previous class. That is supine position. So what is the supine position? The eye should be faced to the roof. And prone position, this is the prone position that you're lying facing downwards. And the lithotomy position. And which speciality commonly use the lithotomy position? Any idea?
Gynecology.
gynecology.
Gynecology, yeah, surgeons and also the commonly used by the gynecology for the normal labor. And here the person is in a supine position and the hip and knees are semi-flexed. Flex means like this. This is the position, flexed. And the thighs are abducted. Thighs means they are placed apart. Okay. And this may help for the adequate exposure for the pelvis and vagina. So, or the genitalia. For the purpose, we commonly use the lithotomy position. So, it's already discussed. So, next we are going to describe some anatomical terms in order to describe the relationship between the body parts or structures related to each other. So the first thing is the anterior. What do you mean by anterior? Any idea?
Front.
Front part
Good.
of
Yeah,
the
front
trunk.
portion or the belly part of your body. Okay, the front part of your body is known as the anterior posture. Next is the posterior. Posterior is the back of your body. Okay, so from today onwards, we commonly use the anterior and posterior for the front and back. Next, what is meant by superior?
Upper
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 position.
portion.
Upper part.
Inferior is beneath, and the central and peripheral. Central is towards the deeper and towards the inner portion, and peripheral is the outward portion. So these superior, inferior, central, and peripheral is the common terminology we use. But the anterior and the posterior is the a new word which is related to the anatomy. This is the superior position, and this is the inferior position, and this is the anterior surface, and this is the posterior surface. And other terminology that we use for anterior is the ventral, and for the posterior is the dorsal one. All right, dorsal and ventral. Next is very important: median, medial, lateral, and intermediate position. Okay, so what is meant by median? Median is the posterior point or organ which is seen along the mid-sagittal plane. So this is the mid-sagittal plane, that if you are drawing a plane through the center of your body and it can divide your body into equal right and left half, then you call it as a mid-sagittal position or the plane. So this is the mid-sagittal plane where you will get a equal right and a left half. All right. So what you meant by medial and lateral? Medial is anything towards the median plane is known as medial, and anything which is away from the median plane you call it as the lateral one. Okay. So I'll ask one question. If you are drawing or a point, there is a point A and another point B. Which one is medial and which one is lateral? Very good.
A is median.
Yeah. A is the medial.
Lateral.
Yeah. A is the medial one is because it is towards the mid-sagittal plane, and lateral one is the B. Okay. Okay. Next, intermediate, any point that is comes in between these two, medial and lateral, is the intermediate. So medial and lateral is also another a frequent terminology that we used in anatomy. So here you can see this is the, which plane is this? This is the
Median.
median or sagittal plane. We have sagittal plane also, that is not at the center. Okay, if you draw like this is also another sagittal plane, but any plane that is going through the center of your body, then that is the mid-sagittal plane. And this is the medial and this is the lateral. Next, what you meant by external and internal? External, which is very close to the surface of the body, then you call it as an external. And internal, which is going towards the center of your body, that is an internal. That is also a common terminology we use. Next, superficial. It is respect to the surface of your body is the superficial one, and the deep is the deeper one, the center, towards the center of the body. Next is ventral and dorsal. We already said that ventral is towards the belly and dorsal is towards the back. So another name of ventral is
Here.
Anterior.
Anterior.
anterior. Anterior, very good. And dorsal is the posterior.
Posterior.
And cranial and rostral. There is any point towards the head, you call it as cranial, and any point towards the tail or towards the lower limb. Towards the lower limb is known as the caudal end. So for example, in this, you have a point A, C, and a B. Okay. Then you can say that A is cranial to the point C and B is caudal to the point C. You got it?
Yes, ma'am.
When you compare, yeah, A is in the cranial aspect because it is towards the head, and B is in the towards the tail end. That is, this is the caudal end and this is the cranial or the rostral end.
Ma'am,
Yes.
is there any difference between superior and cranial?
No, superior is the topmost portion. That's only. But here we are saying about the direction. It is towards the head and is known as the cranial end. And we commonly use all these things, cranial and caudal, we commonly use in neuroanatomy. Okay, when neuroanatomy is we dealing with the spinal cord, brain and all, and inside the brain we have a lot of structures, right? So in order to comparing the positions of these structures, you commonly use this cranial, caudal and all. All right.
Okay, ma'am.
So next is invagination, evagination. Invagination and evagination. Invagination is the inward foot protrusion is known as invagination. This is the inward protrusion, you called it as invagination. And the outward protrusion, you call it as evagination. Okay, invagination is the inward protrusion, evagination is the outward protrusion. And next is about the interior. Interior, we always use interior to know about the inside of a things about the hollow organ. So can you give me some examples of hollow organs? Any examples for hollow organs?
Stomach.
Stomach, okay. Intestine, then
Heart.
heart, stomach, intestine, heart, blood
Liver,
vessels, all these are,
rectum.
yeah, rectum, everything. All these things are comes under the hollow organ. So when you learn hollow organs separately, you should know about the interior aspect of the hollow organs also. So this is that is the interior always we use for to describe the hollow organs. Next, what is ipsilateral and what is contralateral? So ipsilateral always used to mention the structures at the same side of your body, and contralateral is to describe the structures in the opposite side of your body. Okay. So for example, if a patient comes to you in the casualty with some paralysis or weakness, okay, weakness in the right upper limb and right lower limb. The patient came to you with a complaint of weakness of right upper limb and right lower limb. So when you report the case, you say that the patient have weakness at the ipsilateral side. All right. If the patient having weakness at the right upper limb and the left lower limb, then that is the contralateral side. Got it?
Yes, ma'am.
Yes, ma'am.
If you want to refer
Yes, ma'am.
something at the same side of your body, then that is the ipsilateral one. And if you want to refer something at the different opposite side, right or left or like that, opposite side of your body, then you say it as a contralateral.
Ma'am, is it same for the anterior and posterior parts too?
Anterior and posterior, like
Uh, like someone is having problem on posterior side of the body. So are we going to say the same word ipsilateral in that case also?
no, if the patient have something at the posterior aspect of the right upper limb, okay, right side of your body, and also at the anterior or posterior aspect of the left, and there the sides are different, right? This anterior and posterior always refer to the surfaces. And here the ipsilateral and contralateral refers the side of the body.
Ma'am, it is only for outside body or inward inner organ, ma'am.
No, even inside also, like actually, it's just mainly commonly used in the case of nerve tissues lesions, like your cranial nerve lesions or that kind of nerve lesions or paralysis. In that cases, that we use this ipsilateral and contralateral.
Okay,
So,
ma'am.
for example, yeah, got it. When you
Yes, ma'am.
come
Yes,
to
ma'am.
that kind of cases, it will be clear for you.
Yes, ma'am. Yes.
So next is about the some special terms that we use for the limbs. Limbs means upper limb and lower limb. What is proximal and what is distal? So any point which is towards the trunk, we call it as proximal, and if just away from the trunk is known as the distal one. So for example, you have your shoulder. This is a shoulder joint, right? This is a shoulder joint and this is the elbow joint. So which one is proximal and which one is distal? When you compare these two joints,
Shoulder joint.
Shoulders,
the shoulder
proximal,
joint is the
triangle,
proximal one, and the elbow joint is the distal one.
distal.
All right. Yeah. If you are
Yes, ma'am.
comparing with your knee joint and an ankle joint, which one is distal and which one is proximal?
Knee joint is
Knee
proximal
joint is
and
like
ankle is
proximal.
distal.
Ankle is distal.
Yeah, very good. That is any point towards the trunk, you call it as the proximal. Away from the trunk is the distal one. All right. Next is about the radial and ulnar. Radial and ulnar. So radial is the part of your upper limb, which is towards the outer border of your upper limb, and ulnar is towards the inner border of the upper limb. So when you take your forearm, okay, when you take your forearm, there are two bonds are present at the forearm. Okay, two bonds are present. Can you name it?
Radius and ulna.
Very good. At the forearm, that is the radius, so the radius and ulnar.
Ulna.
Which ulna? Which one is medial and which one is lateral?
Ulna is
So we
medial.
all,
Ulnar.
yeah, we already said that what is medial and what is lateral. Anything towards the median plane is the medial one, and away from the median plane is the lateral one. So ulna is towards the median plane, so that is the medial bone, and this is the lateral bone. All right. So the area which is medial of the forearm is, you called it as ulnar surface. An area which is lateral, the forearm is known as radial surface. The bone is radius and the surface is radial. Got it? So the outer border of the upper limb or the lateral border of the upper limb, you called it as radial, and inner border of the upper limb or the medial border of surface of the upper limb, we called it as ulnar. You got it?
Yes,
Yes,
ma'am.
ma'am.
So
Yes, ma'am.
all these things are explained based on the anatomical position. Okay. So this is the ulnar surface and this is the radial surface. Okay. This is the lateral one and this is the medial one. Next, say just like this, tibial and fibula. So what are the two bonds? Which are the two bonds seen at the leg
Tibia and fibula.
portion?
Tibia and
Tibia and
fibula.
fibula.
Tibia and
Fibula.
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 So which one is medial and which one is lateral?
Tibia
Tibia
is
is
Tibia is
medial.
medial and fibula is lateral.
Very good. Fibula is in the lateral aspect. So the surface which is seen in the inner aspect of your lower limb, we call it as a tibial one, tibial surface, and any towards the outer border of the lower limb is the fibula surface. So you clear about it, right?
Yes, ma'am.
Next is about the flexor surface and extensor surface. So in the case of flexor surface and extensor for the upper limb and lower limb, it is in a ulta form. Okay. The flexor surface is the anterior surface of your upper limb. Okay.
Hello, ma'am.
Hi.
Once again, you can explain evil and blood.
Yeah. Okay. In the case of leg, I will show you. So this is your leg, right? From the knee joint to the ankle joint. Here you have two bones, tibia and fibula. Okay. Tibia is the bone which is seen at the inner aspect. So the inner aspect of your bone, of your leg is the tibia and the outer aspect is the fibula. That means this is the medial and this is the lateral. So the medial bone is the tibia and fibula is the lateral bone. Okay. So you call the medial surface of the leg as the tibial surface And the lateral surface of the leg is known as the fibular surface, just like the radial and ulnar. You got it?
Yes, ma'am. Yes, ma'am.
Okay. So next is about the flexor surface and the extensor surface. So just take your like forearm, just look at your forearm, the anterior surface. You just keep your forearm in the anatomical position. Okay. So the anterior surface of your forearm is the flexor surface. Okay. And the posterior surface of the forearm is the extensor surface. Got it? First, you
Yes, ma'am.
keep your forearm in an anatomical position by keeping your palm upside, facing upside. Then that anterior surface is the flexor surface, and the posterior surface is the extensor surface. Okay, that means this is the flexor surface, and the posterior surface is the extensor surface in the case of upper limb. Clear?
Yes, ma'am.
Yes,
Okay.
ma'am.
When it comes to the lower limb, okay, when it comes to the lower limb, and in the reference position, the posterior surface is the flexor surface, and the anterior surface is the extensor surface. Got it?
Yes, ma'am.
The ulta one. Okay, this is the flexor and this is the extensor. That means if you want to flex your upper limb, you do like this, right? And if you want to flex your lower limb, you flex like this. This is the thus you flex the lower limb. So this one will comes at the flexor surface and this is the extensor surface. And this is the flexor surface and this posterior one is the extensor surface in the case of upper limb. Any doubts?
No, ma'am.
Clear?
Yes,
Yes,
ma'am.
ma'am.
This will be clear more when you learn the upper limb and lower limb separately, all the flexor muscles. So what is the significance is that all the flexor muscles of the upper limb are seen at which aspect of the forearm? Anterior or posterior? All the
Anterior.
flexor, yeah, very good. All
Anterior.
the flexor muscles of your forearm is placed at the anterior aspect. And all the flexor muscles of your lower limb is placed at anterior or posterior.
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 Just like all the extensors of your forearm is placed at the posterior aspect of the forearm. And all the extensors of your leg is placed at the anterior aspect of your lower.
Yes, ma'am.
Okay? Okay, very And next is the palmar or a volar surface and plantar surface. So palmar surface is anything towards the palm of your hand. Okay. So the palmar surface is or the volar surface is the palm of your hand, and plantar surface that refer to the sole of the foot. Okay, sole of the foot, otherwise known as the plantar surface. Now, the other thing is the palmar surface. So this is the palmar surface, and sole. This is the sole. This is the dorsal surface of the feet, and this is the plantar surface of the feet. And this is the dorsal surface. Dorsal, no, dorsum. Dorsum. Okay. So for the hand, you have the palmar surface, and the posterior aspect is the dorsal. And when it comes to the leg, the plantar surface. The sole is the plantar surface, and the anterior surface is the dorsal of your foot. Got it? Hello.
Yes, ma'am.
Yes,
Yes,
ma'am.
ma'am.
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
So these are the common terminology. Very small, it's a very small topic. the common terminology that we commonly use in anatomy. What is anterior? What is posterior? What you meant by the cranial, caudal? Then what is medial? What is medial? Just revise the topic. What is medial?
Along the mid sagittal plane.
Along the mid sagittal plane. And what is meant by the lateral?
Away
Away
from
from the
away
Away
from
from
the
the brain.
Away from the mid sagittal plane. And what about the cranial one or the rostral end?
towards head.
Towards the head.
Towards the head. And what you meant by caudal end?
Towards
Away
the
from the
tail.
Towards the tail or towards the lower.
tail.
Then what about the proximal end and distal end?
proximal and near the
Proximal and
Proximal end towards the trunk of your body, and the point away from the trunk is known as the distal. Okay. And what about ipsilateral and contralateral?
same side of the body and
ipsilateral is same of the
contralateral
body.
opposite side of the body.
Opposite side of the body.
Is the ipsilateral one. And which surface is the flexor surface of your lower limb?
Anterior surface.
Posterior.
Here surface.
Posterior one, not the anterior one. Posterior. Yeah. And what about the extensor surface of the upper limb?
Anterior.
Interior.
And can you
Okay, just
explain
tell.
me a flexor surface?
Okay, that is in case of upper limb. Okay, upper limb in an anatomical position. The anterior surface is the flexor compartment, or the flexor surface. All the flexor muscles or muscles which help for the flexing the forearm. All the flexor muscles are seen at the flexor surface. Okay, that is the anterior surface. Anterior surface of your forearm. Next, the posterior surface of your upper limb is the extensor surface. Okay, that means all the extensor muscles or the muscles which help to extend your limb is seen at the concentrated at the posterior surface of your upper limb. All right. Next,
Yes, ma'am.
in the case of lower limb, the anterior surface is the extensor surface, and the posterior surface is the flexor surface. That means your calf region and the posterior aspect of your thigh is the flexor surface. The muscles which are seen at the posterior aspect of your lower limb, which help to flex your joints. Okay, so when you compare the upper limb and lower limb, it is opposite. Okay,
Yes,
Yes,
ma'am.
ma'am.
Yes.
and you will be clear this thing when you detail learn about the muscles, flexor muscles, extensor muscles, you get the idea. Just this is a brief discussion only, just to familiarize all these words and all. That's it. And you will be
Yes.
clear these things when you learn detail about all these things. Okay. So all right, I think you got everything. Any doubts?
Ma'am.
Hmm.
No, ma'am.
No, ma'am. Okay. So when you attend the next class, just go through all these terminologies and just get familiarized with all these things, and only it will be easy when you learn deeper into the anatomy. Okay?
Ma'am, is this
Okay,
first class or
ma'am.
second class?
Pardon?
Is this first class or second class?
This is the second class. The first one was the introduction class, and this is second class. And we have next class is just like this, that some special terminologies related to your joints and all.
Ma'am, yesterday we were informed that today will be our first class because yesterday you couldn't take it.
Yes,
Yeah,
ma'am.
this is my first. Yeah, this is my first class, and that is the introduction class. The Sneha madam took the introduction class. So this is just a continuation of it.
Ma'am, may you please
Okay.
suggest any book so that we can go through just a brief of anatomy?
That is BD Chaurasia. I think that is your reference textbook, right?
Okay.
BD Chaurasia.
Okay, ma'am.
Ma'am, where
Thank
can I
you.
find this presentation or PDF?
Yeah, this will be sent by your coordinator.
Okay, ma'am.
Okay.
Okay.
Go through all these terminologies. It's very important. These are the terminology commonly come across when you read anatomy. So it should be very much thorough. Okay. So anatomy is a little bit
And when is the next class, ma'am?
most probably in a Friday or Saturday. We'll let you know.
Okay.
Ma'am,
Okay.
can we use Gray's Anatomy instead of BD Chaurasia?
Can use Gray's Anatomy also, but it is little bit standard textbook, so it is difficult for you to understand the starting stage. So better you go through BD Chaurasia. And for exam purpose, I think BD Chaurasia is better because Gray's Anatomy is vast subject. So vast book. So they explain everything very detailed. It's good to read Gray's Anatomy. It's very good to read Gray's Anatomy, but for the exam point of view, I think BD Chaurasia is little bit good for you.
Thank you, ma'am.
You
Okay,
can
ma'am,
read Gray's
I
Anatomy, no problem. Okay. If you can catch up everything, then it's very good to read Gray's Anatomy. It gives you a very good base. Okay. Any
okay,
doubts?
ma'am. Thank you. No, thank you.
No,
Okay,
ma'am.
thank you so much.
Ma'am,
Okay.
ma'am,
Thank
can
you,
we use
ma'am.
Vishram Singh as well?
Thank you, ma'am. Thank you,
Comes
ma'am. Thank you,
wish.
ma'am.
Okay, okay, Sharon, thank you.
Ma'am,
Yes?
can we use Vishram Singh as well?
Yeah, Vishram Singh is also a good book. But when comparing Vishram Singh and BDC, I suggest BDC only, BD Chodas.
Okay, ma'am.